Hi everyone, I hope you all are well and safe at home. So today we're going to talk about isotretinoin and its role in acne treatment, in acne management. This is the episode 3, Living with Acne. So just a bit of a preview. Um, we've already discussed about what acne is and why people get acne, what is the main reason behind that, what they can do at home to keep the acne under control, or the treatment options available. In the episode 2, we discussed about the question and answer related to episode 1, and also the topical treatment available to buy over the counter, like benzoyl peroxide, salicylic acid, adapalene, and other things. So today is the third episode. There were so many questions about isotretinoin, so we are only going to focus on isotretinoin today. Nothing other than that. So there will be another episode next Sunday. So any questions from any of the episodes, if you have, just feel free and send me a message or just post it on this thread, and I will address it next time. Now, acne is my quite favorite subject because I see patients with acne every day. And it is quite difficult as well. It is linked with a lot of mental health issues, low mood, anxiety, because it's very visual. So isotretinoin is a big kind of, people call it a big boost for acne. That's when I see my patients or my clients in the clinic, they say that, well, they feel isotretinoin is the only thing which is going to help. Which is not actually true, but let's talk about what it is, how it works, and what you should know about it. So in different countries, like here in UK, USA, and a few other countries, the isotretinoin is a prescription-only medication. And in other countries, even including Pakistan, it's available over the counter. I'm not sure if you have to have a doctor's prescription to buy it. So that is that can be very dangerous as well. If you don't know about it and you're using it, it is one of those medications which is a specialized only, kind of a drug to use. So anyway, so the first question was, what is ruacetine and what is isotretinoin? So ruacetine is a brand name of isotretinoin. So it belongs to a group of medicine called retinoids. So retinoids, in the last episode, we covered that it can be topical, or it can be oral. So isotretinoin is an oral retinoid. You can take one tablet once a day. It's with the food. And what exactly it does, it's a vitamin A analog. So vitamin A is really, really important. Three main reasons of vitamin A. The first one is that it's an immune boost. So it works on the immune system. So if you don't have enough vitamin A in the body, your immune system may be very weak. So it's really important for that. Second thing is that it is very important for your vision. So people with low vitamin A can have problems with the vision, especially at night vision. And that's why isotretinoin is important when we prescribe it in patient, because it works in a different way. And sorry, I'm just reading the comments as well at the same time. So I'll come to that in prescription in a second. And the third and the most important thing is the reproduction. So that's why people who are using vitamin A analogs like isotretinoin or acitretin or alitretinoin, which is slightly different. We don't use that in acne vulgaris, but they're the similar family group. They should not get pregnant. People should not get pregnant or conceive children because it can cause serious reproductive problems. And fetus can have problems with the physical appearance as well, plus the intellectual complications. So it is very serious. I see when we see patients, clients or patients, they have to sign a disclaimer form, and we have to make sure that they are on a contraceptive medication before we start isotretinoin. So I'll come to that again. I'll cover that in how I prescribe it and what are the things which I go through. So these are the most important functions of vitamin A. Vitamin A is naturally present in many products. So it has like two different types, which is naturally present. The first one is present in meat, poultry stuff, dairy food, and it's quite good. You can just use it. The second, so having an increased intake of that, you are optimizing the vitamin D daily requirement. The second is in the green vegetables, especially broccoli and carrots. They are very rich. Fruits like mangoes are really rich in vitamin A. However, they are very rich in sugar as well, so you have to be careful. What else? So you have to make sure that if you're on a balanced diet, then you're having enough vitamin A. So the daily requirements of vitamin A in an adult man is roughly about 900 microgram, and in a female it's about 700 microgram. I'm so sorry, I have a bit of an itchy nose because I suffer with hay fever, and it's one of my hay fever season with pollen. So I may just from time to time get watery eyes and a very itchy nose. So, and I do apologize for that. So that's about the vitamin A. So when we come to the isotretinoin, if you're taking oral isotretinoin, you should not be taking. You have to be careful with the multivitamins or the vitamin A rich food. So salmon, one of the fish, has got maximum amount of vitamin A. So you have to be very careful using that, because excessive amount of vitamin A tends to get stored in your blood and in the tissues. And we don't want excessive vitamin A. It's not very good. It causes a lot of problems as well. That's about what. So how does it work? We don't know actually 100% how it works, but it has two major mode of action. The first one is that it works on the oil producing glands. So if you remember, if you've watched the previous episodes, where I have mentioned the oil producing glands, the sebum glands, which is the main problem. Sorry, which is the main problem in the in acne. And so it just dries up the sebum gland, and as it dries up, it also decreases this. It also works to decrease the size of the gland. So in acne, when you're getting these breakouts and you see these spots, which are cystic acne or nodular acne, it tends to kind of decrease the size, and that's why it helps. The second thing is that, if you remember, I've already touched about something called keratin, which is present in the top layer of the skin. And what it does, it just clogs up the pores. And the sebum, the oil, which is from the oil producing gland, struggles to kind of get to the top surface of the skin. And that blocks the gland further and facilitate the bacteria. So what it does, it tends to get rid of the keratin and helps the oil to release from that apparently tight sebum gland. So that's the major two actions. Now, there was a question, somebody has said that they are on acitretin for acne. Is that the same? So acitretin is a retinoid. We don't use it for acne vulgaris, which is the teenage acne. We use it for acne rosacea. So it works in a slightly different way. We do use it for psoriasis as well. So I'm not sure if, because it is more anti-inflammatory rather than anti-sebum. So its action is different. The other question was that how long you can use it. So I'll cover that in the prescription, when I see patients, how I prescribe it. Few very quick things about isotretinoin, that it is a dermatologist prescription only medication. So in my cosmetic clinics or in my aesthetic clinics, I see many clients who have been prescribed a very low dose of isotretinoin, maybe 20 milligram, or sometimes, they're left on it for like 3 to 6 months. This is wrong. it's not licensed to be prescribed by any doctor. It has to be a dermatologist because of the risk associated with it, and I'm going to cover that risk in the prescription section. And a very low dose of isotretinoin does not usually work. So sometimes when I'm seeing clients, I'm actually starting them with a really bad flare up of acne because we're only meant to use isotretinoin when we're thinking it's a severe, medium to severe acne where we are worried about the scarring. So at that stage, if I'm giving you a very small dose of acne, it's sorry, a very small dose of isotretinoin, it's not going to work. Yes, retinoids are generally good for skin. So you may notice a bit of a glow and a bit of other rejuvenation type of a thing, but that's not the reason for anybody to use isotretinoin oral. So topical is very different, and we can touch that in a different section. Also, the isotretinoin needs close blood monitoring. That's why it's, buying a drug over the counter in different countries where it's available, it can be very tricky. Because if you don't have these blood monitoring done, it can cause really serious problems. And I see this, so I prescribe it every day. I stop it every day. It's a difficult medication to handle. So if you're going to see a cosmetologist or an esthetician who is giving you a low dose of isotretinoin without any blood test, just be very careful. Okay. The questions are, sorry, I've just written a little bit of a structure for me not to kind of get lost in the run of talking. So the questions are: we have to be careful. Pregnancy, breastfeeding, certainly big. And people cannot get pregnant on it. They have to be on two contraceptive measures before we start. If it's a female, and we do advise the men to kind of not father. However, it's not kind of strongly evident with males, but this is really important. And as I've mentioned, because one of the roles of isotretinoin is reproduction, so it can cause severe fetal problems. And I have seen patients getting pregnant on that, and their scans are really difficult, and most of them, they end up with termination of pregnancy. So it's really important, and we have to keep on checking that throughout the course. So the course, usually it's like for 6 months, but depending on how much dose we've given you, the dose is equal to dose works according to the weight, and as well, and also how severe the symptoms are. So sometimes if we calculate the overall dose, because there is a maximum dose we cannot we cannot give it beyond that. So calculating the maximum dose, sometimes we can just purely a dermatologist can give you another couple of months on the top, then we have to stop it. And we don't tend to give you another course very quick. So you have to take a break, and stopping the drug after 1 month, you cannot get pregnant either. And most of the other cosmetic treatments, you have to be careful. 6 months usually we say off, especially for things like microneedling and chemical peels and laser hair treatment, because it can make your skin super sensitive afterwards as well. So what else? Okay, so somebody has asked about St. John's wort. So I'm not a herbalist. I don't know a lot of herbal remedies, and I don't know how it works. But what we know definitely as doctors or dermatologists, especially the St. John's wort, is not very good. It actually tends to interact with any medicine So and so it's a no anyway, and certainly a no with isotretinoin. You should be seeking a medical advice if you think, because many people are using St. John's wort, sometimes for skin and sometimes mostly for depression or anxiety. Now, what are the things? So about 9 out of 10 people, they respond really well to isotretinoin, and they respond quite quick. But similarly, 9 out of 10 people, they have severe side effects from the isotretinoin as well. It tends to work better when you have, kind of severe or kind of nodular or cystic acne. However, it does not work a lot on the scarring. So many people, they come and they feel that isotretinoin is going to take away all the scars. It's not true. Some Sometimes maybe it can work if there is very subtle scarring, but deep pitted scars, there are different types of acne scars. So their expectations then kind of are quite unrealistic, and you have to be careful with that. So the side effects, okay, so the side effects are the it causes so as I've mentioned, if you understand, go through the how it works. So it is drying the oil glands. So your skin will be super dry. So when the skin is super dry, it causes more inflammation, and it's also more vulnerable to sun damage. And dryness so causes inflammation. Inflammation causes further. So it's a constant cycle. And I see a lot, especially the dry lips, and they're cracked, and it's quite difficult. So you can't then use oil products on to cover that, because we are trying to reduce the oil anyway. Usually, if that happens, it's usually short. It is quite short period of time. However, sometimes 6 months after stopping the medication, you can still have very dry skin. Sometimes people can develop eczema, and if they develop it, it's quite difficult, because if I increase the dose of the drug, the eczema is dry skin, it gets worse. So if I decrease the dose, then the acne is not going to respond. So we have to be careful with that. What else? So the lips are the most commonest areas of concern, and usually using lip balms constantly. Vaseline on the lips are okay as well. If you suffer with perioral dermatitis, that can be a bit of a problem, because using Vaseline, it's going to occlude the area. So it's a bit of a tricky part. But if I tend to see really severe dryness, I tend to drop the dose, and it gets better. So as I've mentioned, the skin can be super sensitive afterwards as well. So even simple procedures like waxing or shaving can be a bit of an difficulty on daily basis, and you have to be careful with that. People can have really dry eyes. So sometimes if you suffer with that, it's okay to buy a simple preservative-free eye drops, and you can use it throughout the course of treatment. It can also give you hair fall. Hair loss is quite temporary, so it's not permanent, and it does not cause any scarring of the scalp. So the only thing is that if it's quite severe, then dropping the dose helps it, and it's very quick. Within like 4 weeks to 6 weeks, clients respond very quick. Okay, so one of the other commonest symptom is nosebleeds, because it's drying up everything. So the nasal mucosa or the lining of the nose tends to dry up faster. So using maybe a bit of a Vaseline inside your nose is quite sensible. Now, how do I prescribe it? So when I see a patient with acne, the first visit of the clinic, we have to go through what it is, how it works, and if the patient is suitable or not. So if sometimes I see referrals. So in my NHS clinic, sometimes when I see patients have already had the blood test done, liver functions, the full blood count, kidney functions. Lipids is really important, and checking their sugar level, something what we call an HbA1c, is really, really important. And if they are stable, then on the first visit, I can start isotretinoin. And usually the starting dose could vary, sometimes from 30. And I increase the dose very quick. Maybe within 2 week cycle, I take them to 40 milligram, and 60 milligram to 80. 60 is quite decent and strong dose. So it totally depends on on the background of the bloods as well. Now, if you have anybody suffers with mental health, low mood, or depression, anxiety, or past history of self-harm, it's a very difficult drug to use in this situation. Because there's an evidence linked with it that it can have a knock-on effect on your mental health. So every visit prior, we screen the patients for mental health, and every visit we actually screen every client. And I have seen few deaths on isotretinoin as well. It suddenly gives you really impulsive feelings of self-harm. So it's really important, because most of these patients, or most of the clients, are really young kids, they're in their teens, so there is a lot happening anyway in their life, so you have to be extremely careful. What else? So sometimes it can give you visual problems, and one of the commonest visual problem is night vision can get affected. So people who work in aviation, if they start on isotretinoin, they have to inform their employer, because that can affect their visual acuity, and sometimes it can, very rarely, I've never seen a patient, but sometimes it can cause permanent visual loss as well. So people in that employment group, they cannot start isotretinoin without informing their employee, their employer. Sorry. So we've touched all of that, and in the next, so stopping the isotretinoin within 6 months, usually tattoos or piercing and these type of procedures, we don't recommend. So the other thing is that if you are if somebody who is very active, very sporty, or young athletes, you have to be very careful, because isotretinoin can store a lot of lipid or a lot of fat in your body, and exercise tends to cause some breakdown of the muscles, and this can facilitate the process. So they can have severe aches and pains. They can have severe muscle, something we call myalgia, to the point that everyday simple activities would be very difficult for them. So you have to be very careful. If that happens, then again, dropping the dose is important. What else? So I think I've touched most of the things. Yes. So because it stores the fat in your body, so your cholesterol check is very important. So Asian people, especially us, we are at a high risk of cardiovascular risk and high lipids. So it's really important not to buy isotretinoin if it's available over the counter and just start that. The other thing is that certain medications you have to be careful, especially using tetracycline and antibiotics like doxycycline and etc. It can cause problems, and other immunosuppressant medications like methotrexate or oral vitamin A supplements, you shouldn't be using it, because it accumulates the dose in your body. Also, there are certain medications which are available for weight loss, which tend to block the absorption of fat-soluble vitamins in your body. So, which sometimes can block the vitamin A, which is a fat-soluble vitamin. So you have to be careful. If you're on any of those medication, you need a vitamin A supplements over the counter, because sometimes that can make your skin really sensitive and can cause a lot of problems. Okay, so I think I've covered literally everything, whatever I have been asked. Okay, yeah. So the only other thing is that if you, in terms of kind of working on your dry skin, if you're on isotretinoin, then usually usually dermatologists recommends ointment as an emollient better than creams. But in acne, the ointments, because they're oil based, so they tend to clog the pores faster, and as a result, they can block the oil glands as well. So then, to cover the dryness, creams are better in this situation than ointments. Okay, so I think we've touched and covered alitretinoin just a little bit. Somebody's asked about that. It is we don't use it for acne. We use it mainly for really bad hand dermatitis or hand eczema, which does not usually respond to other treatments. And acitretin, I've already mentioned, we use it for psoriasis and rosacea, and sometimes when people are having more squamous cell cancers and things like that, we can use it. So, but we don't use it for acne vulgaris. So thank you so much for watching. I think it's enough for today, and you can watch the other previous 2 episodes and watch this. And if there are any more questions, just feel free and send me a message. Until next time, look after yourself, and I will see you later.